morning, good afternoon, good evening to all of you joining us from all over the world. And I'm thrilled to welcome you to my own fireside chat this afternoon. I'm Dr. T and I'm joining you from Johannesburg. And I am joined by fantastic colleagues in the field of family planning. The community is that much richer for having had them as our rapporteurs for this conference. UHC Not Without Family Planning, our first ever virtual conference, which really slammed so many records from the registrants and of course the number of countries that were represented. And as you will hear today from all of them when they introduce themselves, they will share with us from where they are joining in the world. And I think just to say thank you very much to all of you for joining us and for making this virtual two-day conference really, really special. And from the get-go, I just want to let you know that this is a highlight, this is a summary of all of the things that we are passionate about as the community. I'm a medical doctor, for example, and I had some real challenges, during COVID-19 in terms of stock outs and legislations around telehealth. We'll hear from our colleagues on this call as well about what their challenges are. But most importantly, we know the family planning community is resilient. We are really, really committed to making everyone have access to their contraceptive of choice. And we know fundamentally, we believe in the right of everyone to decide if, when, and how many children and how to space those children. And with those words, I'm going to let Barbara just give us her feelings and her highlights from that amazing opening plenary that we had on day one. And from then on, I invite all of you, my friends, my colleagues, to just join me on this fireside chat to really recap all of the things that move us, that we are passionate about. Barbara, over to you.
Thank you, Dr. T. And indeed, it was a great opening, and it put everybody on the same stage and ready to move forward for those 2 days. And the words that come to my mind were voices of youth. As Dr. Kanam said, 1.6 million strong youth around the world ready to take us to the next step in family planning. Also important were questions of justice, equity, and accountability. And once we address all of those issues, I feel that we are going to be able to move together towards the 2030 agenda and also making the link with FP 2030. So I felt the beginning just put us really well, placed us ready to address how youth are going to move us forward.
Absolutely, and I'm biased, right? Because I still fall into the youth category. And what really was important for me about this conference in general, the International Conference on Family Planning, is that the youth are not necessarily just there on stage, right? Just to be seen. We really are leading and setting the agenda and really taking charge of this space and of this community. And we are the next generation and our future is literally now, right? And so I just want to hear from other colleagues, is there anything else that stood out for you? I know many of us, are still sort of recipients, right? And we are the patients and the clients. At the same time, we may leading programs. But maybe I'll just, push that on to Trinity. And let you take over and just let me know what has shifted and moved for you.
Thanks, Dr. T. I'm Trinity and calling in from North Carolina. And I just wanted to pick up on something that you just said, which I have a lot of other technical thoughts, but there were some very personal moments and seeing youth, particularly in the Real Talk, Real FP, Real Voices session at the end of day one, speak so passionately and so determinedly about what they know to be their rights and how they are capable of going out, creating and fostering the right conditions and the right environment to be able to meet those needs was truly incredible to me. And I say that as a mother of 2 boys, the oldest is just a teenager, and it made me think so much about how I need to keep in mind his own capacity to make decisions that are important to him. And it really touched me. I just was so blown away by the courage and the determination of those young people and seeing them active in this space. And I've been working in this for almost 20 years. And I already know that I need to take a step back, but this was a good reminder of let people step up. So I was just blown away.
That's incredible. I mean, Helen, coming from Nigeria and joining in, virtually, what were some of the themes, right, that you found common? Because often, you know, when we're having these challenges, we think we are the only ones experiencing them because that's all that you can think of. That's, you know, it's like in your daily life. Is there anything else that Helen came through for you, listening to the stories and seeing other programs perhaps that you know resonated with your situation in Nigeria?
Thanks, Dr. T. Yes, Helen from Nigeria. And you're right. It's hard to get away from the fact that a lot of women in Nigeria have to choose between a family planning method and necessity like food, you know, due to out-of-pocket costs. It was Dr. Natalia Kanem that mentioned that during the opening plenary. And it's also a point to note that family planning is not always defined as essential in Nigeria. Not all methods are included and not all costs are covered. But I really liked the Thailand example, Dr. Yunop, in the second day 2 plenaries, when he talked about some of the successes that the country has had in implementing universal healthcare and family planning. So it left me with a lot of high hopes that with success factors like strong leadership, coordination, and cooperation among stakeholders, government and partners, that there is a way to chart, you know, a path forward.
That's incredible. And Kate, has anything shifted for you in the last 2 days? What would you like to share with us?
Yeah, thanks, Dr. T. This is Kate Rademacher. It's just a real pleasure to be here with colleagues and you around the world. The last 2 days left me just really energized and inspired. I have been fortunate to be, I think, at every ICFP since the first one in 2009. Wow. So this has really been a week of not just of excitement and nostalgia. I've been pulling up my photos from past ICFPs and remembering good times with colleagues, and it's hard to not be in person, but I'm getting chills just talking about it. I think I feel so fortunate to work in this field because, as we know, family planning is central to all areas of global development: health, gender equality, environmental sustainability. You know, it's just everything. And so I think to be working on something that touches on so many areas of human rights and development is it's really an honor, and to have such amazing colleagues around the world. So I came away feeling very hopeful and inspired and excited. It was also great to hear voices from so many different sectors. And I think I was part of the private sector panel. And I think to really be hearing about the importance of the private sector and the partnerships that we have between government and NGO players and private sector, and just the diversity. When we say private sector, we may think of something very narrow, but you know that includes everything from digital health platforms to telehealth to social franchises to manufacturers to distribution, and that all of these players work together with the faith-based organizations, the public sector, the NGO sector, to, as Helen was saying, you know, collaborate, coordinate, and get these essential commodities and services to the people who need them. So, you know, really, I think we heard so much about the challenges of COVID-19, but there are a lot of success stories too.
You are so correct, you know, and I recently went back to full-time clinical practice and, you know, trying to balance that with, of course, you know, the United Nations special rapporteuring for the right to health. And then this huge COVID-19 pandemic sort of, you know, it was like a punch in the gut, right, for many of us. And besides sort of the difficulties, of course, that we know collectively globally in terms of the public health, you know, planning and financing, it really showed me and proved to me what we've been saying all along at ICFP, that we need to consider family planning as an integral part and element, right, of not only the right to health, but for gender equality, right? We need to make sure that human rights center even clinical practice, and that we remind the private sector of their own responsibilities in terms of maintaining and upholding human rights. And so, you know, Dr. Solomon, just taking off from there, what has been your experiences? And, you know, there could be policy or pragmatic or services related that COVID-19 kind of put a speed bump on, and how did you overcome some of those challenges of COVID-19, because really that's the reason why we are even here virtually, right? We should have been together in person. Over to you, Dr. Solomon.
Yeah, so thank you so much, Dr. T. My name is Dr. Marsden Solomon. I'm from FHI 360 Kenya. And indeed, if I can weigh in on the issue of how COVID-19 has impacted, just from my own experience here in Kenya, the idea here is to ensure that the restrictions that are there for COVID-19 do not impede the continuation of provision of services. And in this particular case, I'm talking about provision of family planning services and mother and child, or maternal and newborn health services. So one of the things that I know is very important is obviously have policy guidelines being adhered to that will encourage the continuation of services. We at the same time making sure that there's adherence to the COVID-19 pandemic prevention measures so that the clients and the health workers are safe when they are providing those services. So policy, or we can call it government guidelines to assure and ensure that those services are provided is critical. At the same time, the healthcare workers have to be equipped to be able to, and so that they can have the right protection as they are providing. So they have the right PPEs, and also the clients who come and seek. Now, to go about this also will require the use of approaches which will not enhance the engagement, direct engagement with the client. For example, the use of digital platforms in terms of bookings for appointments is something which is quite useful. And some of the provision of services can be done through phone calls or telephone approaches. Yeah, so that's one of the things that I can, just weigh in. But from if I'm just to indicate some of the other digital solutions that were provided by some of the presenters or speakers of yesterday, I wanted to cite an example from Uganda, where they were using, they were basically targeting the youth, and the youth form the bulk of the population, but they have issues. They have, they can't access the right information, and they can't also get the right services, especially in this particular case was contraceptive services. Mm. So, there was this, what is called the contraceptive Google map, which really indicated, to the youth, especially in some part of Uganda, Kampala city for that matter, where they would know from the use of the Google map by using their laptop and of course with a good internet, they will be able to identify health facilities which are stocked with the contraceptive methods of their choice. And by that, they would not need to move around a lot with, of course, the COVID-19 pandemic looming in. They would be able to go straight to the place where their contraceptive method of choice is available. This again was quite, I thought it was quite useful and fairly innovative to navigate around the problem. Yeah. Thank you.
Thanks, Dr. Solomon, for that, because I remember as a health provider, the types of policy and legislative restrictions, right, to the use of telehealth and virtual medicine. And one of the things I keep saying is, oh my gosh, even when we have the COVID-19 pandemic under control, can we keep some of these? Because it's so important, and it has enabled access, right, in ways that before we were not able to. And in my mind, I'm just thinking, why did it have to take such a catastrophic event for all of us to want to have, young people access? And I remember seeing early on in the pandemic, a photograph from Uganda of condoms and family planning being distributed, like a delivery service on the back of a motorbike. And that always stuck with me. And digital health and interventions, even as a special repertoire, is something that I'm really, really aiming to bring forth to show how that not only enables services, but it also enables information to make informed consent. And so, Fred, just coming straight from you, what are some of the lessons, right, that you can share with us, especially from Uganda? You are experiencing this firsthand. What can you teach us? What did the other participants in the conference share, that stands out for you in terms of digital interventions and innovation?
Thank you, Dr. T. And Kampala is where I'm seated, that Solomon alluded to. So, and of course, anything to do with digital health connects again very well with the young people. Of course, in Kampala as well, but also in many urban centers. What we, I think, have to realize also is that in this context, there's a lot of urbanization happening. I think when I started out in this field, Uganda had 1 city, now we have 10. So it shows you that the number of young people who will take up innovations, who will move to the cities, from the rural areas is also growing, and so we have to think of things in that direction. But relating to the conference and to digital health, what I picked up was first that really intrigued me was a session on family planning in humanitarian settings where the word resilience came in. And that struck me because I quickly thought, what does resilience mean as we do family planning in the era of COVID-19? And before I went into this session, that's the question I had. And all these people were speaking from countries where they had huge disasters, like Vanuatu, where they had a storm before COVID, and then COVID also came. But what I learned was that because they had learned to prepare for disasters, they were also able to prepare for COVID-19 and therefore continue certain services, especially including family planning, where they ensured that they had systems that allowed that to happen. They're used to setting up mobile stations. They're used to having special teams and that kind of thing, which maybe we need to learn in our usual programming to be ready for emergencies. That's one thing that kind of struck me. That was across countries like DRC, where they had Ebola, Yemen, where they had a war, and then we had Vanuatu, where they had a storm. In relation to digital health, I picked up one statement from a lady from the Rademacher Institute in a session that I rapporteured on innovations in family planning research. And she was like, of course, COVID-19 gave us the opportunity to introduce telemedicine or telehealth. But then she was emphatic to say that this shouldn't make us forget that we need to think about access, quality, and ethics as we do telehealth. Telehealth should not be the poor woman's source of poor health. I thought that was striking.
Absolutely.
Yeah.
And you know what, Fred, taking on from what you're talking about, telehealth, and one thing I have, and that I'm still processing for myself and to understand further, it is the idea of self-managed care, right? About how much a lot of sexual and reproductive health rights and services, and for me, I use this word deliberately, it's been relegated to self-care, and not much of medicine is referred to as self-care. And how do we balance the state's responsibility to ensuring that wherever you are in any country as a young person, you should be able to get dignified care, be treated with dignity in privacy, and get the services that you want, versus the limitations of COVID, and then our innovation necessary in terms of self-care and self-managed care. And Barbara, I'm not sure if you have any ideas on this particular issue, but you're more than welcome to take on from what Fred was also saying. But just when he said the telehealth, ethics, quality of care, I suddenly thought, gosh, there's a big movement to self-care and self-managed care. And how do we balance?
Definitely. And thank you. And I forgot to say where I was coming from. So I'm joining from Brooklyn, New York. so there are two issues here. There's the issue of equity, and there's the issue to what extent does self-care help to address that? And one of the key points on equity that came out that really struck me was, again, Rademacher, who one of the panelists said that if the world committed to addressing adolescent and youth needs, there would be 55 to 65% reduction in unwanted pregnancies, unsafe abortions, and maternal death. And that tells us, that brings it home, we have to address inequities. And when a youth panelist stands up and says, and speaking back to COVID, their health inequalities kill more people than a single disease. And what we need is to get over the sociocultural barriers that prevent us from getting to healthcare. We need to get rid of the economic barriers that prevent us to getting to healthcare, in particular family planning. So as we look at inequities, and we can look at also what are the solutions to that, and self-care and family planning access around information, around management of one's own body, knowing issues around menstrual health, period tracking, all of this information needs to be accessible for individuals to have the agency to decide where and what to do. And self-care encompasses all of that, helping individuals to take a little bit more control. That doesn't put the provider outside of responsibility for quality care. It doesn't put the government away from what is its inherent responsibility for ensuring healthcare for all, but it does allow for individuals more control. And that's an area, as you noted, it's new, it's exciting, and there's a lot of research that's needed to do it. So the two come together, equity and healthcare, I think are essential to build upon each other.
Barbara, you are spot on, because one thing again that I always talk about, right? It is the criminalization of adolescent health and access to SRHR, right? And so self-managed care and self-care, especially when it's led, like institutions like the WHO, UNFPA, it really does a lot in terms of right protections, because at the end of the day, we are talking about rights here, you know, and we must operationalize them in terms of programming, in terms of health funding. But at the end of the day, it is about human rights to autonomy and to dignity. And Trinity, you wanted to say something?
Yeah, it got me thinking about something along those same lines that Ellen Starbird mentioned in one of the IBP-led sessions about how USAID initiated the high impact practices about 10 years ago because there was a lack of consensus about what worked in family planning. And she was noting that we now have made great strides in what works in family planning in terms of delivering services through specific interventions, including those to reach young people. What we don't still know, I think, is where and how to adapt within those. And there was so much rich experience coming of sessions about adaptations, not just in the face of COVID, but many of those, but that don't always get captured in documentation. And that's something that I'm really passionate about, is how do we capture the evidence of what's working in implementation to put it out? And that includes, who are we reaching? How are we affecting equity and inequity? And so I just felt so excited about the rich experiences and some of the roundtables I participated in. And my call out as we look forward is for people to keep documenting that, keep sharing that, using platforms like ICFP and IBP network to really bring those to the forefront, and let's capture them so that we're all learning from each other.
Absolutely. And just before we wrap up, I'm going to give each of you maybe a little, a minute or less to give you your final thoughts. But I really just want to just thank all of you, right, for your time and for really putting the energy that you have into this, and encourage everyone to go look at each of the sessions from day 1 as well as day 2 to really find all of the scientific, research, the issues around policy and advocacy, communications, issues of, private sector and the provision of family planning, and of course, the issues of healthcare funding, financing, and COVID-19. So in less than a minute, I'm going to start definitely with Kate. Let me know your thoughts, and then I will do just a summary at the end before we say goodbye.
Great. And again, thanks, Dr. T, for moderating this discussion, for all of your incredible leadership globally and during the conference. I think my final just takeaway was, as I mentioned previously, I've been fortunate to be, I think, at every ICFP. And what really, I think, came out was the successful emphasis on universal healthcare coverage, and that how FP is unequivocally needs to be a part of UHC. And I have to say, I have to admit that I don't remember UHC being such a big part of past conversations. And to be honest, I don't give it enough attention in my own technical work. And so I really was inspired and educated and challenged to think more about how family planning has to be an integral part of UHC and how we have to fight for that and really be, as a field, at the forefront of the discussions about UHC moving forward. So in that sense, I think the conference was a huge success because in my own personal reflections, and I think hopefully for all of us as a community, it really elevated the issue. Thanks.
Mm-hmm.
Thanks, Kate. And Helen?
Yes, so I'd just like to echo some of the sentiments from day 2 plenaries. I think it was Dr. Elizabeth Sully who said that we are sort of heading towards what we are looking at post-COVID with, the vaccine coming out and a lot of countries trying to chart, a way forward. We do have the opportunity to build back better. I believe those were her words. I really like the sound of that. We have the chance to do things not just better, but differently. So we've already said things like self-care interventions and telehealth, but we sort of have to start thinking about how we're going to do those things in a way that doesn't exacerbate inequities, because we already saw how COVID-19 exposed the big divide, between people that have, things like technology, internet access. So we really need to start thinking about how we're going to do things in a way that, our innovation doesn't cause more inequity. So I'm really, really liking the idea of building back better.
Fabulous. And Dr. Solomon?
Yeah, thank you, Dr. T. I think one thing which I'd like to emphasize, and maybe we shouldn't miss out, is actually the need to use women voices to bring up policy change or to bring up policy directions that will enhance delivery of services in a particular region. I'm actually citing this by making reference to an experience from India in the Sindh province, where they were using women they gathered women and they gathered together where they exchange suggestions and provide solutions. And these voices were now taken over to engage with the government of that region. And so much so that actually it resulted in an increase, in a budget increase, a significant budget increase that went towards improving family planning delivery services. So I think that's that's an item that should not be overlooked when you're looking at improving family planning, access to family planning services.
Thank you. Frederick, in less than a minute.
Thank you, Dr. T. I think for me, at this conference, I appreciated that the push for family planning as part of UHC has been ongoing for a while. You could see from the submissions by people, but also that ongoing and has to continue before we actually get there. And there are several things that are very important, including ongoing advocacy and adaptations that are necessary for advocacy, for instance, even within contexts like COVID-19 pandemic. Because I learned at this conference when I participated in a session on advocacy that there were so many adaptations. For instance, when people couldn't meet physically, the leaders, they adopted to the media, they got the Twitter handles of the influencers. And so I think that I found that really interesting, that there was adaptation on that side as well to keep family planning on the agenda and prioritized. Thank you very much.
Thank you very much. Barbara, do you have something to say?
I just want to circle back to the whole idea of accountability. And as we are in the decade of action leading us all up to the Sustainable Development Goals in 2030 and the agenda that we've all committed to around the world, the link between universal health care, the Sustainable Development Goals, and now the fact that FP is front and center shows that we're all integrated, as you said earlier, but that most importantly, we all need to have a common framework of accountability so that we're moving together. Mm-hmm. And that accountability framework needs to be grounded in country priorities, and that it's not coming from anywhere else. It is coming from where countries want to go. And as long as we can reach that and respect that, I think that we will all arrive together at 2030 in achieving UHC with strong family planning front and center.
Mm-hmm. Thank you so much. Thank you for that wonderful wrap up. And you're making me think of a quote. It's actually one of my favorite quotes by Audre Lorde. You know, she says, there is no such thing as a single issue struggle because we don't live single issue lives. And I think that's what the community of family planning is trying to say, right? Is that think of young women and girls in terms of their entire life cycle and all of their reproductive health needs. And we know for sure that access to modern contraception really changes the lives course of women and girls. And that there can never be any universal health coverage scheme that excludes family planning that will be just. And again, it talks about accountability. And what I'm taking away from all of this is that because young people are not spoken of or to, they are speaking for themselves. Mm-hmm. And that says a lot about setting the agenda. It says a lot about the buy-in that's required to make programs successful, to have policymakers and legislatures in the future that understand the human rights to autonomy and the human rights of girls and women. And I think just in wrapping up, I do want to say that without transparency, without trust, there can never be accountability. So it's on all of us in the different family planning communities, wherever we are in the world, to remember that it is very key to be accountable to each other and ourselves, to the communities that we serve. And ultimately, that is what will make sure that there is justice at the end of the day. And of course, there can never be universal health coverage without family planning. And with that, I want to say thank you so much friends for joining me from wherever you are in the world. I implore you to please go back on our YouTube channel, International Conference of Family Planning, to have a look at some of these wonderful sessions that my friends here have been talking about. And again, if you do have any questions, send us the email, and of course, go on to our ICFP2021.org website. And again, I really wish to see you all in person in Thailand, in Pattaya City, later on this year. Everything should be going well, fingers crossed. And thank you so much. And that was, of course, our fireside chat wrap up of the Not Without FP Family Planning Virtual Forum. Thank you, everyone.
Thank you, Dr. T.
Thank you.
Bye.
Bye. Bye.